topic is hypovolemic shock. We are going to answer 5 questions as usual. So, the hypovolemic shock, as we remember, it's among the top 10 killer conditions in Africa, probably worldwide. The topic is into 2 parts, where part 1 we are going to address 3 questions. But before we go into details, we need to remember that the shock, hypovolemic shock, is going to affect these 2 organs: the heart, which is supposed to send blood to other parts of the body, and the brain, which controls the body. So once there is no volume, blood, oxygen reaching the brain, it means the whole body will be affected. Let's get these 3 questions answered. What is hypovolemic shock? What causes hypovolemic shock? And what are the signs and symptoms of, and how do we diagnose it? Now, there are many types of shock. Shock can be septic, that is due to infections. Shock can be anaphylactic, allergic, like a bee sting. A bee sting, then the body reacts. It can be neurogenic due to the function of the nervous system. Cardiogenic shock, the heart fails to work, then the patient goes to shock. Hypovolemic shock, which means bleeding, hemorrhage, or severe dehydration. Obstructive shock, like a tension pneumothorax, where it's like a suffocating someone. Drug induced, or the drugs can cause shock. But today, because we cannot talk about all of them, we will have time where we see each one by one. The topic today is going to be just hypovolemic shock. We'll see this one. Okay. Now, hypovolemic shock is defined as advanced hypovolemia. It's a medical emergency which will need a quick intervention. Hypovolemia is what? This word hypovolemia it has 2 words inside. Hypo means low, then volume. Then when the low volume in the blood, in the system, then it will lead to shock, which is what? Insufficient amount of fluid inside the body that lead to heart to fail to pump enough blood. Hypovolemic shock occurs when there is a decreased intravascular volume to the point where the heart will be compromised. Hypovolemic shock is the most common type of shock in children. It is very common, but mostly common due to diarrhea diseases. So diarrhea vomiting will cause the depression of water in the body. Then the hypovolemia will take place. The shock will come. It is common in developing countries, unfortunately. Hypovolemic shock can lead to organ failure. Remember, if you don't have blood, enough fluid, enough water in the system, the kidneys will shut down. That is renal failure. Hypovolemic shock is a life-threatening condition. Really, it is. Hypovolemic shock is the most common type of shock. We saw many types of shock, but this one, hypovolemic, is the commonest. Young children and adult people, older, are the most susceptible. Then when you lose more than 20% of the body fluid, that's the time now you enter into the risk of what? Hypovolemic shock. Let's see the causes a little bit in detail. You see, when the blood loss comes into place, the bleeding from digestive system, or bleeding from serious wound, the cut, or vaginal bleeding, like in time of miscarriages, bleeding from blood trauma, injuries due to accidents, or internal bleeding from what? Abdominal organ or ruptured organ. These can lead to a serious hypovolemia, which will lead to shock. Let's see this a little bit into details. Like somebody who might have what you call varices. varices in the esophagus. The swelling of vessels, the vessels in the esophagus, due to other conditions, like somebody having cirrhosis, liver cirrhosis, the liver has stopped working, it is swelling, it has become like a stone, then it will compress the vessels, and the result will cause the vessels in the esophagus to swell. So most of times, because this swelling might rupture, when it ruptures now, there will be a massive bleeding. That's what I call digestive tract hemorrhage by rupture of varices, a serious cut. The accidents, whether on the road or trauma or violence, is common. If like a big vessel is cut, then the bleeding will take place. A very serious bleeding that can lead to hypovolemia. Miscarriage. Normally in the uterus, the baby is inside, is in the amniotic sac, normally. But now, when the placenta gets detached abnormally, then the product might come out. When it comes out and the placenta does not come out in totality, it will lead into a serious bleeding, very severe. It's very common and it is very severe. You see, it's an incomplete miscarriage. When it is incomplete, it's very bad. All right? Or it can even bleed without seeing a product outside, but it bleed from inside, with inside. A rupture of a spleen, for example, during a trauma. Something hit the abdomen, there is no cut, but the organ inside is cut. It's like when there is a vessel cut inside. But the spleen, if now it ruptures, you will have a lot of bleeding inside. The blood, the pool of blood will be full in the internal organs. This will lead to what? Hypovolemic shock as well. You see, ectopic, normally in the uterus. Here you are entering vaginal canal, you enter the cervix, here is in the uterus. This is where the baby is supposed to stay during pregnancy. Now, if it happens that by mistake or by nature, by failure of the pregnancy to go and stay where it is supposed to be, what will happen? The pregnancy will go and grow outside, here in the tube. Then around 4, 6 weeks, 10 weeks, what will happen? The tube, because it is not made to contain a fetus, it will grow until it ruptures. Look, once it ruptures, the bleeding will take place, and it can bleed profusely. Then look what will happen in the internal organs, in the abdomen. The bleeding will be full, then it will lead to hypovolemic shock. Dehydration secondary to diarrhea disease. It's common in children particularly. Or severe burns. You burn, then all the water gets depleted through the skin. Excessive sweating or excessive vomiting. There are also renal losses. Renal losses due to salt or sugar. Remember, wherever salt is, the water follows. So the water will follow the salt, or if there is a lot of sugar attracting water, remember a diabetic patient will be passing urine every moment because of high blood sugar. So those are the conditions that will lead to dehydration. Then hypovolemic shock will take place. Skin losses. Somebody staying or in a very hot environment where now sweating will be inevitable. Sweating a lot will lead to dehydration in the particularly dry climate that we have some part of the world. How do you know that one has hypovolemia or is going to be into hypovolemic shock? It starts with the mild symptoms where there is nausea, fatigue, headache, dizziness, or profuse sweating. When it becomes more severe now, the symptoms will be pale skin, weakness, confusion, because the brain now is getting affected, Weak pulse, there is not enough volume to cause the pulse of the heart to be felt in the vessels. Hypotension, because there is no pressure in the vessels. And rapid heart. The heart will pump fast, trying to overcome the problem. Those are the symptoms. Lightheadedness or cold clammy, the skin will be cold. Consciousness will be lost in a very short time. Little or no urine, there is nothing to put out. The blue lips, the oxygen is not reaching the extremities. Then blue, the lips becomes blue, the fingers, the toes, they become blue, and you see it before any other organ. Rapid, shallow breath. You can see the whole system, the whole body is getting affected. Thank you for the part 1. We are going to see part 2, and don't miss it. You're welcome.